Hello, my name is Anne. I'll be demoing the ultrasound exam of lower extremity today. So I'm gonna use 12 linear probe, and I have a patient in supine position with leg rotated externally like a frog leg. And I just slided the higher of the bed head. And then on the patient who has some kind of difficulty to rotate their leg, I'm gonna put some towels or a blanket underneath their hip to reduce the pressure and discomfort for the patient. And to start, I'll be quick sweeping through. I will do quick sweeping through the whole leg from the CFV and GSV junction to popliteal with the compression. So compression is the way to rule out the DVT. So I'm gonna do quick but very carefully to make sure the compression is done completely. So I'm gonna check complete collapse every few centimeters. And then for distal, I'm gonna put my hand underneath the patient so that the patient doesn't have any discomfort and pain with the probe, hard compression. And popliteal too. Okay, I'm done the quick sweeping with the compression. So I'm gonna take representative images on dual screen mode with the compression. So I'm gonna start on CFV and GSV junctions. I found it. And I adjust my focus and depth. And dual mode, I'm gonna update and compress completely. And next, my image would be femoral vein prox and profunda femoral vein. So I'm gonna find for vessel view, and then I'm gonna stack. I found it, and then I'm gonna press, check if it's completely collapsed. And next, femoral vein mid. And I'm gonna adjust the depth and focus. I'm gonna press completely. And the next, femoral vein distal. And as I talked about before, I'm gonna put my hand underneath the patient's leg so that I can press with probe and my hand to reduce the patient's pain and discomfort from the pressure. And I lower down the frequency for the penetration. And I'm gonna compress. We found the vein and artery and then compress the distal vein. Take the images. And next, popliteal vein. So I'm gonna put my probe behind the patient's knee and higher up for the proximal. And adjust my depth and focus. And I found the popliteal vein prox. And I'm gonna compress. And then I'm gonna go down to popliteal vein, not mid, distal. And I'm gonna go down to until the vein split. Then this is good for the distal enough. So I'm gonna compress the distal. That's it. I'm gonna take the images here. And next, my images will be the sagittal view, grayscale, color, and spectral Doppler. So I'm gonna put my probe on patients, in patients inguinal crease again. And I found it and rotated my probe to get the sagittal view of CFV, common femoral vein, and gray saphenous vein. So I'm gonna teach this out a little bit, but I'm not gonna use TGC too much because I don't wanna erase important hypoechoic possible thrombus. So I'm gonna take this and then color. It's a little bit bleeding, so I'm gonna use adjust the gain. So a little bit increase the gain, decrease the gain, and then I'm gonna keep the images here and then spectral Doppler. I don't need to use an angle correct, so I'm gonna tie it up and take the Doppler signal for CFB. And I'm gonna adjust the baseline augment. So wrap it up. So adjust the color and then take a picture. And then GSV, gray saphenous vein too. I'm gonna put my sample gate on gray saphenous vein. And that's enough. So adjust the baseline and then just augment. I'm gonna do the augment, but I don't like that, so I'm gonna try one more time. And augment here. This is slightly augment, not wrap it up, but I think it's enough. So I'm gonna put augment label on here. And next, femoral vein plugs and profunda femoral vein. So I'm gonna find them and stack them in line to get good sagittal images. I found that and slightly rotate my probe to get sagittal image of femoral vein proximal and profunda femoral vein. I can see the valve here. So I'm gonna check with color if I found the right vein. So I'm gonna adjust the gain and the TGC a little bit to clear it out, but I'm not gonna use that too much. And here, I think that's okay. So I'm gonna take it and then next, femoral vein proximal plus a spectral Doppler augment thing is okay, good enough. So I'm gonna take this image here and next is the profunda femoral vein. I'm gonna put my probe on profunda femoral vein and then augment is phagic flow and then augment all wrapped it up. So I think that's good enough. I'm gonna take it. And then profunda vein, femoral vein mid. I'm gonna find it mid femoral vein and rotate the probe to get grayscale, femoral vein mid. Yeah, I can see the vein, the valve here. Then we I got the good femoral vein made. And then next the color, that's good enough. Take it picture, and then spectral Doppler on the mid area. And I'm gonna augment here. I'm gonna take a picture here. The next is the distal. So on grayscale first, I'm gonna find the distal vein here. So rotate my probe to get sagittal view. I'm gonna adjust the focus a little bit. There's some echo, but I think that's good enough. I don't want to erase, I don't want to TGC out too much. So I'm going to use that in color. And I think that's good enough. So take a picture and then spectral Doppler in this tall area. So I'm going to adjust the scale to appropriate size of the spectral Doppler and then augment. I think it's good enough. So take a picture. And next, the popliteal vein plaques. So I'm gonna find popliteal vein plaques first on transverse, and then rotate the probe to get sagittal image. And I think that's good. So a little bit higher up, and I think that's good. So decrease the depth. And take a picture, and then just the color. That's good enough. I'm gonna take it. And spectral Doppler. So I'm gonna increase the depth at the scale and augment. And that's good enough. Take a picture here. Then distal, I'm gonna go down, follow down the vein. That's the distal. I'm gonna adjust the focus to clear it out and take a picture in the color. And adjust the color box size. That's good. A little bit of bleeding, but it's okay. And then spectral Doppler. Then augment here, beautiful augment, but I got arterial signals too, so I'm gonna try again. So one more time. I'm gonna do the popliteal vein distal again. It's very close to each other, the artery and veins, so I'm gonna try one more time to get clear spectral Doppler from vein. And augment here. That's good enough. I'm gonna take this image here. And then next, I'm gonna check the calf vein, posterior tibial and peroneal veins on patient's calf. So I'm gonna do quick sweeping through the calf with compression to check if there's any thrombus, possible thrombus in the patient's veins. So first, I'm gonna check with compression So increase my depth and adjust my focus. And I'm gonna compress to make sure all veins completely collapsed. So I'm gonna decrease the depth and then focus. And I'm gonna find good spot to compress. So PTVs here and PTVs here and peroneal veins here, and then we'll collapse the veins. That's good sign for patient. Carefully compressed to the distal and ankle area. And I'm gonna find a good spot to take a representative image with compression. So I think that's a good spot. And on dual screen mode, I'm gonna do the compression and take a picture. So here, PTV and PR. So I'm gonna put a label for posterior tibial vein and peroneal veins. And take a picture. And next, I'm gonna get the sagittal images with color to make sure the of the patency of veins. I think that's good spot. So slightly rotate my probe. Usually I find the sagittal veins, calf veins near the bone. So adjust my box size to get both of them. I'm gonna try to get both of the veins, posterior veins, the tibial veins and peroneal veins. So I'm gonna slightly compress the ankle distal area of the patient's calf to get color. I follow the veins to check the patency. Slightly rotate to get sagittal veins and press a little bit distal. And I think that's okay to show the blood flow in the veins, a little bit bleeding, but I'm gonna take it and then retry to get one more images, a little more clean, and then accurate images. So I'm gonna press a little bit to get clear images and press. I think that's okay, that's good enough. So I'm gonna send it back to get images here. Yeah, the image shows the old patency of the vein. So that's it. This is my ultrasound of lower extremity scan demo today. Thank you for watching.